We are back. We're talking about your open enrollment questions answered. These are your top 5 open enrollment questions that you've been asking lately. Open enrollment season is coming in hot, you guys. If you haven't been scrolling TikTok and all the things, everything is trending right now, okay? Open enrollment season is trending. People are upset about these premiums. People are starting to be like, hold up, lean in, tell me more about this whole membership care thing. I need you guys to lean into this open enrollment season because we are done just taking the same old healthcare plan that we've always taken just because it's the way it's always been done, and just taking these same increased prices year after year after year. Like, people are sick of it and are interested in learning more about these more higher quality healthcare plans that can actually save you money and increase the quality of your care. Let me pause for those who are new here. Welcome. I'm Dr. Jade. I'm a board certified family medicine physician. I'm from Las Vegas. This is my hometown. I'm the founder and medical director of NSPIRE Primary Care, and I am passionate about quality healthcare in our country, but especially in Las Vegas. I'm excited that NSPIRE Primary Care has been providing high quality care for the Las Vegas Valley for almost 4 years now. And I'm here to answer your open enrollment questions. I've been putting down the top 5 questions that I've been getting asked the most. We're going to chat about it. We're going to talk about the open enrollment updates you need to know for 2026. Are you ready? All right. If you're joining, drop in the chat where you're joining from. I'm joining live from Las Vegas at NSPIRE Primary Care. Drop questions. If you have open enrollment questions, drop them below. If you have questions about NSPIRE Primary Care, direct primary care, membership practices, if you have no idea what any of that means, don't worry, hold tight. We'll get into it, okay? All right, your open enrollment questions and updates that you must know for 2026. Let's go. Number 1 is that the costs are rising. Traditional insurance plan costs are rising. People are getting hit with the sticker shock of these new 2026 premiums and deductibles and copays. And it is noted right now and predicted that this is one of the highest increases in premiums since 2016, okay? We're heading into 2026, but this is the highest increase in 1 year on how much insurance has gone up since 2016. It is estimated to be an average of a 12% increase. Typically, it's around 8 to 10%, but it's about a 12% increase on average, so it gets higher than that, okay? Here's the thing, I shared this before, but I want to remind you, over 60,000 Las Vegans, this is just in Las Vegas alone, over 60,000 Las Vegans are estimated to either become uninsured or underinsured in the new year due to the cost of these traditional health insurance plans, employers being forced to stop offering health insurance. It's a whole thing. So we really want to lean into this open enrollment season and think about, okay, do we just need to take this traditional PPO HMO? And I got some secrets behind this too, that I don't know if you guys saw the news about United Health closing all of these clinics all across the country. So now people are signing up for these health insurance plans and they have no idea that there's actually less doctors, less providers, less staff, less people to actually care for you behind those plans. So let me pause and let that sink in. This is the highest increase in the cost of health insurance in over a decade. Yet, there are less doctors, providers, healthcare facilities than ever in those plans. You're paying more for less. Please, we've got to stop saying, I've got the good insurance. You've got a plastic card that may or may not pay for high cost things, okay? So we got to actually lean into what a health insurance card means. We're hoping that high catastrophic events won't send us into bankruptcy. Like, that's what insurance is supposed to be about. But we're going to talk about the solution, okay? All right. So costs are rising higher than ever. All right. That's number 1. Number 2. Employees are frustrated, okay? The employee frustration is at an all-time high. The biggest complaints we're seeing online about the health insurance is that they can't find doctors that are in network, so they have an insurance card, but when they try to go use it and they call a doctor's office, which is what's going to be happening with United Health, okay? They're going to be calling doctor's offices and they're going to say, we don't take it anymore. It's not in network, okay? So they're paying and it's not in network. They're having longer Visit wait times. In Las Vegas, the average is 3 to 6 months to see an insurance-based doctor because we're in a medical desert. Very few primary care providers compared to the population. All right, they're getting surprise bills. This is a part that's like crazy work, right? We are paying more. We're paying these high premiums every month. We're having to pay out of pocket thousands to just meet the deductible before the insurance will even start kicking in. But then we're still getting surprise bills on the back end because insurance inflates everything, including your labs, your imaging, and every other aspect that you touch in healthcare has an insurance markup 5 to 10 times the actual price of what it costs. So then you're having prior authorizations. So then you're trying to get that MRI that you need, etc. But then the insurance company is saying, wait, let me think about if we want to pay for it. But you've been paying every month. Like, this is what people are complaining about. But I just met with 2 businesses today. So if you're a Las Vegas business owner and you have a team and you want to know if your team is interested in us providing this type of high quality benefit for your team, and this will save your business money on the healthcare expense. And we've got a secret tax, it's not a secret, but we've got a tax deductible way for you to offer this for your business. First of all, pause. If you're a Las Vegas business owner, you want to be at our Lunch and Learn December 12th, okay? RSVP at the link in bio because we're going to go in detail about the tax deductible healthcare benefit that's going to provide higher quality care to your team while lowering the cost of healthcare for your team on your P&L. Lean in. Take a note of that. You want to be there, okay? Now let me circle back. I just spoke at 2 businesses today, okay? And the teams had such great questions, and the employees, everyone had such great questions, but I asked them, what are some of the issues and frustrations you have? And they mentioned not only the things I already mentioned, but long wait times in the waiting room. They're like, when I actually get an appointment that took me over a month to get, I'm waiting forever in the waiting room, right? And then they come in and the doctor's there for 5 minutes. Another person said, I always have to go to quick care, but it's not quick. That's another name for urgent care, right? I have to go to quick care, but I'm waiting 3 hours. So these are the things that we are solving at NSPIRE Primary Care. Lean into, okay, let me pause. Because people are like, wait, what is membership healthcare? Why am I not using insurance in the primary care office? What are you talking about? So let's lean into this. Let me take a step back. Let's think about this. Why don't we still go to Blockbuster for our movies? Why do we do Netflix now? I'm pausing because it's what? Because it's accessible, because it's modern, because we've evolved from Blockbuster. Same question. Why do many people Amazon things instead of going to the store for everything? Convenience. We've modernized things, right? We have a higher quality way to do this from home. All right. Why do we mostly hop in strangers' cars, aka Uber, instead of getting into taxis? Why is that the old school thing now? Because we've evolved, right? And so healthcare is one of the few areas that is taking time in this evolution, but people are sick of insurance. They're sick of being, I don't want to say scammed, you didn't hear from me, but they're sick of paying a high cost for something that actually isn't providing them care. And so I need you to lean into modern ways to access higher quality care for less money. That is what the future of medicine, which is now here, direct primary care, membership primary care, that is what NSPIRE Primary Care is. Your whole healthcare team at your fingertips, okay? Unlimited primary care, which is 90% of all your healthcare needs for a flat monthly or annual membership. If you have insurance, you use it for the 10% of things needed outside the primary care office, catastrophic events, how we should use every insurance, right? For surgeries, hospitalizations, for high cost aspects of healthcare. But your primary care, NSPIRE Primary Care, is your healthcare home. All of the 90% of urgent care, chronic care, preventive care, things that you need, you just come to your healthcare home for that. You text us, you email us, you hop on phone or video or Zoom, or you come in office, okay? So I want us to get into getting out of this old school way of thinking of, I got the good insurance, I'm good. That no longer has the value it once had back in the day, all right? That's Blockbuster way of thinking. That's taxi way of thinking, all right? I'm just trying to give it to you straight because I don't have too much time. All right. All right, here we go. I don't see any questions yet, but you guys, I'm going to be coming back on. So drop any questions you have about open enrollment season. I'm going to be doing a series, an open enrollment series, where I come on and talk about, I'm going to try to make it weekly. Okay. I'm going to come on. I'm going to try to make it weekly and talk about open enrollment for you guys. So if there's any questions you have, if I'm starting to get your juices and your wheels turning, drop it below. I will come back next week and answer your open enrollment questions, okay? So this is a huge shift. Next week, I'm going to talk more about number 3, which is the big shift from PPO, HMO, traditional health insurance plans towards pairing high deductible healthcare plans or HSAs or indemnity plans or health share plans. If you have no idea what I'm talking about, I'll come in and give you more details on the next live, okay? Pairing those that cover the catastrophic much more efficiently than these bloated PPO, HMO traditional plans, and pairing that with NSPIRE Primary Care or direct primary care concierge style practices like NSPIRE Primary Care. That way they have the high quality care with their healthcare team at their fingertips, plus a quality customized catastrophic plan that actually will cover what they need outside of the primary care office. We are customizing our care. We are being strategic this open enrollment season. We are done saying, I got the good insurance, I'm just going to keep signing up for the same old thing, If you're in the Las Vegas Valley, NSPIRE Primary Care, we'd love to be your healthcare home. If you have questions and you're like, I want to learn about this, but I need to ask some specific questions for myself and my family situation, text us. Text Team NSPIRE. We're a text message away. We're at 702-867-0017. So shoot us a text message. We're happy to answer your questions. We have an open enrollment special going on right now. If you enroll in an annual NSPIRE membership, concierge or specialty membership during open enrollment season, we are taking $400 off your open enrollment annual membership plan. This is the biggest discount we have given to date. So do not miss the open enrollment season or the open enrollment special. If you're like, I want to take advantage of that, I want to get locked in, just text the word annual to Team NSPIRE and we'll get you set up. Okay. That's 702-867-0017. You all, deductibles are climbing. That was number 4. And number 5 is that this is the most important open enrollment season in years. Lean into what your healthcare plan actually provides you. What type of care is actually at your fingertips? How can you access your doctor? What kind of experience are you getting? What type of customer service are you receiving? What type of bedside manner? Are you rushed? Can you reach your doctor? Like, these are the questions we need to ask. We need to customize what we value in our healthcare, what we need in our healthcare, and then find the plans that will solve that problem. Okay? Find and sign up for the healthcare plans that will actually serve you and provide you with quality care. If you're in the Las Vegas Valley, NSPIRE Primary Care would love to be your healthcare home. I'll be on the lookout for if there's any additional questions. I gave you a speed one today. I don't see any anything in the chat, any questions, but I'll be on the lookout for questions. I'm going to be having open enrollment tips in my stories. I'm going to try to do it daily, Monday through Friday. I'm going to give you guys some open enrollment nuggets that you need to know. As questions come to your mind, DM us, text us, or drop it in the comments, and I will create a live next week and content around it. All right, it's always a pleasure to serve you all, and NSPIRE Primary Care is here to be your healthcare home. Take care. Bye.